friends, it's Biz. Today we're going to go over visiting a loved one with COVID-19. So why is this important? Well, most hospitals are now limiting how many visitors a COVID-19 patient or maybe even a regular patient may have. And this is to limit the spread of infection both between the patients and our communities. So there's a couple things that we should think about before selecting what visitor is the designated visitor. And the first thing that we should think about is the person healthy. The visitor must be in good health because they will be screened as they enter either the hospital or the unit. And what we're looking for is any signs of fever, cough, or sneezing. The second thing we should think about is if the person's able to wear personal protective equipment. Personal protective equipment is special clothing we wear to prevent the spread of infection. As you can see up in the corner, the photo there, this is the special equipment that has to be worn when visiting a patient with COVID-19. So the first piece of equipment is the mask that she's wearing. So it's important to think about, is the visitor claustrophobic? Because they're going to have to be wearing this mask during the entire stay. Also, it's important to consider if there's any type of breathing issues so that they're able to tolerate the mask. Second piece of equipment is the gown. Although it looks thin there, it does get very hot very quickly. So is the visitor able to tolerate heat? Once again, that gown cannot be removed during the stay. Third piece of equipment is eye protection. It's either a pair of goggles or a face shield. She has on a face shield up in that picture. It also cannot be removed during the entire stay. And the last piece of equipment is gloves. And staff will assist you with putting this equipment on to ensure that it's being worn correctly. The third thing that we should think about is the person able to communicate clearly with the care team. And this is a really important part. They're going to be able to hear or need to be able to hear and speak well in this setting. The hospital setting is already loud and hectic. They're likely to have machines or devices in the room like an IV pump or a breathing machine that's making lots of noise. And the medical staff will also be wearing the same protective equipment that's going to cover their mouths and possibly muffle their speech. The fourth thing that we want to consider is if the visitor is able to communicate effectively outside the hospital. So as hospitals are strained for adequate staffing, there is less time for communication to occur between the nurse and other family members via the telephone. And the best way to explain this is nurses are now requiring more time to put on and take off their protective equipment. So imagine you're a bank teller. And before the pandemic, you didn't have to wear any protective equipment. And now during the pandemic, your bank is telling you that you have to put on and take off equipment between each client. Well, it might only take 1 or 2 minutes, but it adds up during the day. So time is being burned putting on and taking off the equipment. So it's the visitor's responsibility to take accurate information about the condition of the loved one back to family members. So good options for the visitor is someone who has a medical background or maybe communicates regularly with other family members. Poor options would be the elderly or those with limited mobility because putting on that equipment does obstruct your view with the shield, obstructs your mobility with the gown. Also, another poor option would be those with strained relationships within the family because the communication then is poor. Other options to consider if you're not the selected visitor is maybe Apple FaceTime or Google Duo, telephone calls, messages sent, written notes or cards. We've also seen posters, which mean a lot to the patients. And we understand that it's important for both patients to see, speak, and interact with loved ones. Also ask the hospital if there's other available resources. Some organizations are providing maybe like an outdoor tent, communication devices, or window visits. So in summary, we want to make sure that the visitor is healthy, can tolerate protective equipment, communicate clearly inside and outside of the hospital, and it's always good to consider alternative options if you're not the selected visitor. Well, friends, that's all for today, and now you are one step closer to being an expert in all things hospital. Stay tuned for upcoming videos.